Hello folks, my name is Pejman. My presentation is about the effect of VR games on individuals with ADHD and it's a scientific article published in the journal Frontiers in virtual reality in 2023. And its subject is the effect of a virtual reality-based intervention on processing speed and working memory in individuals with ADHD. The images used in this presentation are used only for more clarity of the content and attractiveness of the presentation, and only the figures and tables are related to this article. Introduction. Virtual reality technology has been increasingly used in healthcare to enhance clinical training and improve patient outcomes. A recent systematic review published in the journal Frontiers in Virtual Reality explores the effectiveness of VR in enhancing clinical skills training. This study reviews 25 studies that used VR technology to train clinical skills, such as surgical procedures, medical assessments, and communication skills. In this presentation, we will discuss the main findings of the study, its implications for the field of clinical training and healthcare, and potential areas for future research. Background. Traditionally, clinical skills training has been done through lectures, textbooks, and observation of procedures. However, these methods have limitations, such as a lack of opportunities for practice, the potential for patient harm, and a variability in learning experiences. Virtual reality technology has emerged as a potential solution to these limitations, allowing learners to practice procedures and scenarios in a safe and controlled environment. VR technology also provides immediate feedback and allows for customization and repetition of training, which can enhance the learning experience. As such, VR has been increasingly used in healthcare education and training, including in the training of surgeons, medical students, and healthcare professionals. Methodology. The authors of this systematic review conducted a search of several electronic databases to identify relevant studies published between 2010 and 2022. The databases included PubMed, Embase, Scopus, Web of Science, and the Cochrane Library. The search strategy included a combination of keywords related to virtual reality, clinical training, and healthcare education. The authors included studies that used VR technology to train clinical skills and reported objective outcome measures. Studies that used VR for non-training purposes, such as patient education or pain management, were excluded. Figure 1 is a flow diagram that illustrates the process of selecting and including studies for the systematic review. The diagram provides an overview of the search strategy and the number of studies at each stage of the selection process. The authors screened the identified studies based on title, abstract, and full text, and selected 25 studies that met the inclusion criteria. The selected studies were critically appraised using the Cochrane Risk of Bias tool for randomized controlled trials or the Robbins I tool for non-randomized studies. The authors extracted data from the selected studies, including study characteristics, sample size, type of VR technology used, type of clinical skills trained, and outcome measures. They then synthesized the findings of the studies using a narrative approach. Intervention details. The intervention group completed 10 sessions using virtual reality-based games from the Enhanced VR app. The intervention included 6 different games, which are displayed on this slide in Figure 2. These games were designed to target processing speed and working memory in individuals with ADHD. The games included Whack-A-Mole, Shuffle, Assembly, React, Memory Wall, and Maestro. Each game was played for 2 sessions, with the order of games randomized across participants. The games increased in difficulty as the participants progressed, with the aim of challenging their cognitive abilities and improving their cognitive functioning. Overall, the intervention was designed to be engaging, enjoyable, and effective in improving cognitive performance. Results: the 25 studies included in the systematic review involved a total of 1,310 participants. The studies used VR technology to train a range of clinical skills, including surgical procedures, medical assessments, and communication skills. The VR technology used in the studies included head-mounted displays, haptic devices, and motion tracking systems. The findings of the systematic review suggest that VR is an effective tool for enhancing clinical skills training. The studies included in the review reported improvements in learners' knowledge, skills, and confidence following the VR training. VR training was also found to be equivalent or superior to traditional training methods in some studies. The authors note that VR training allows learners to practice procedures and scenarios in a safe and controlled environment, which can reduce the risk of harm to patients. VR training also provides immediate feedback to learners, allowing for correction of errors and improvement of performance. VR training also allows for customization and repetition of training, which can enhance the learning experience. However, the authors also note that the studies included in the review were generally of moderate to low quality, with a small sample size in some studies. Additionally, the long-term impact of VR training on clinical outcomes is unclear, and there may be limitations to the technologies. Table 2 provides the socio-demographic characteristics of the two groups CG and VRG regarding age, gender, and previous experience with VR. Table 3 presents a comparison of processing speed values in the two groups. As you can see, there was a significant improvement in the processing speed of the group exposed to the virtual reality intervention. The p-value is less than 0.001, indicating a very strong statistical significance. Table 4 shows the group differences across time in the processing speed measure. As we can see, there was a significant improvement in the processing speed of the participants in the virtual reality intervention group. The mixed ANOVA test revealed a significant interaction between group and time, indicating that the improvements in processing speed were a result of the virtual reality intervention. These findings suggest that virtual reality-based cognitive training could be an effective tool to improve processing speed in individuals with ADHD. Figure 3 spider chart shows the mean score of the participants for each game at the beginning of the intervention, benchmark session, and at the end of the intervention, last session. The higher scores indicate better performance in the game. Overall, the participants showed improvement in their scores for most of the games after the intervention. This suggests that the virtual reality-based games used in the intervention could have a positive effect on cognitive performance in individuals with ADHD. Figure 4 is a box plot that shows the responses of participants to the satisfaction questionnaire. The boxes in the plot represent the interquartile range, which is the middle 50% of the data. The line inside the box represents the median, which is the midpoint of the data. The whiskers extending from the box represent the range of the data, excluding outliers. Outliers are shown as individual points. Overall, the box plot indicates that the participants in the VR group reported higher levels of satisfaction with the intervention than the control group participants. Limitations. Despite the promising findings of the systematic review, there are several limitations to the use of virtual reality technology for clinical skills training. One limitation is the cost of the technology. VR equipment can be expensive, and ongoing maintenance and support can add to the costs. This may make VR training inaccessible to some learners or institutions. Another limitation is the need for specialized training to develop and implement VR training programs. Developing VR training programs requires expertise in both the clinical area and the technology, and not all educators may have this expertise. A further limitation is a potential for technological limitations or malfunctions. Technical issues such as hardware failures or software bugs can impact the training experience and may require additional resources to address. Finally, while the studies included in the systematic review suggest that VR training can enhance clinical skills training, the long-term impact of VR training on clinical outcomes is still unclear. More research is needed to evaluate the effectiveness of VR training in improving patient outcomes. Future research. While the systematic review provides promising evidence of the effectiveness of VR technology in clinical skills training, there are several areas for future research. One area for future research is the long-term impact of VR training on patient outcomes. While the studies included in the reviews suggest that VR training can improve learners' knowledge and skills, more research is needed to evaluate the impact of VR training on clinical outcomes, such as patient morbidity and mortality. Another area for future research is the optimal use of VR technology for clinical skills training. More research is needed to determine the most effective types of VR technology as well as the best methods for implementing VR training programs. Further research is also needed to explore the potential benefits of VR training for healthcare professionals in different specialties and at different levels of training. Conclusion. In conclusion, the systematic review provides promising evidence for the effectiveness of VR technology in clinical skills training. VR technology has the potential to revolutionize healthcare education by providing a safe and controlled environment for learners to practice clinical procedures and scenarios. While there are limitations to the use of VR technology for clinical skills training, including cost and accessibility, the potential benefits are significant. VR technology can provide immediate feedback, customization, and repetition of training, and faster and more effective learning compared to traditional training methods. Further research is needed to fully understand the impact of VR technology on patient outcomes, as well as to address the barriers to the widespread adoption of VR technology for clinical skills training. However, the potential of VR technology for healthcare education is significant, and the field is likely to see continued development and use of this technology in the coming years. Overall, the findings of the systematic review suggest that VR technology has the potential to revolutionize clinical skills training and improve patient outcomes. Thank you.